Chapter 11, real quick. Well, I can't even say real quick for real. We will get through it. All right. On page 302, and I'm gonna need for you to follow along because I forgot my book downstairs. And
You want to use the
no, my other book has some notes, but it's okay. I put them over here, so it should be fine. Page 302, pregnancy. Know that it is divided into 3 stages and that it lasts how many weeks?
14.
40 weeks?
Each trimester is 13 weeks.
Okay.
13.
Each trimester is 13 weeks, but it lasts how long total? Give or take.
37, 40.
Okay. You do need to know this because if a patient is pregnant and they are like 50 weeks pregnant. 50. Right. Okay. So not a problem, right? That's why I said you need to know how long total it is. Okay? I'm just saying. All right? During each stage, of course, there is different or various changes that does take place as it relates to the baby's growth and development and as it relates to preparation for birth. Okay? And we as registered nurses specifically, OB nurses, okay, if you do become one, need to understand these changes to provide safe and effective care. On this slide, I'll also put that pregnancy requires a precise alignment of 5 psychological or physiological pillars, which includes number 1, implantation, of course. It also includes placental functioning, all right, and then the maternal adaptation, fetal growth, and of course, we are concerned, like I just mentioned, again, with timing. Okay, this is where you are concerned about duration, especially about labor, for example, cervical dilation, the cardiac rhythms, etc. All right, so pay attention to those main pillars. Now, on page 302, we also need to know about the signs of pregnancies. I believe it's on that, correct me if I'm wrong, there is like a table there.
Yeah.
Okay, that little table. Make sure you know what is considered positive, presumptive, or probable signs of pregnancy. Yes, you do need to know them, especially for passing this class, and also you might get it on NCLEX. Be mindful that when it comes to presumptive signs, it's mainly subjective. And what is subjective data again? What the patient tells you. Okay, so some probable, what are some of the presumptive signs listed in the book? Huh? Why would amenorrhea be subjective?
Because they're telling you they haven't.
Okay, because what she said. What else is another presumptive sign of pregnancy? Huh? Breast enlargement. What else? Fatigue. What else? Nausea. Fatigue. Okay, maybe some people might actually have some vomiting, but okay, so those things. And then some people, when you feel, is there any other signs that's under presumptive not mentioned?
Yes, that's urinary frequency.
That's what I want to hear. Fetal movement. Oh my God, something's moving in my belly. Now, most Caribbeans think it's just gas. Okay? But, or if it's one of them old school Caribbeans, they're going to ask you, nothing? Oh, you see your neck. And they're going to look for other signs, to things that be careful, All right? But you must know, according to this book, for testing purposes, presumptive signs, including quickening. All right? Because again, this is what the client is saying that they feel. Probable, you'll notice that it has both subjective and objective data. Give me some of the probable signs, Zelda.
Of what?
Okay, pregnancy.
Sorry, I was reading something.
Oh, probable signs of pregnancy.
Positive pregnancy test.
Huh?
Positive pregnancy.
Ooh, you would think a positive pregnancy test would be a positive sign that you're pregnant.
Sometimes they're false.
Yeah.
Why would it be false?
Faulty tests.
Okay, maybe a faulty test. What's another reason, Chella, that a positive test would be not positive, that you, not a positive indicator that this client is indeed pregnant?
Oh, cancer.
That would be
She said that.
Yeah, she said that. Mm-hmm. Do you okay? Since you want to jump the gun, do you know what cancer? Or it's not really cancer, but it's
Like a tumor.
it's a tumor. Do we know the name of that tumor? Huh?
Or is it ovarian tumor?
No. I think ovarian is one of them. Yes, I'm lying. There's one of them. There's the name I'm looking for. Is that uncommon name? Begins with an H.
Is it the thyroid? Hypothyroid?
No.
Is that the one with like DNA cells in it? The hypothalamus? No.
Okay, in the interest of time, because Caleb is like, give me the answer. Hydatiform mole is because hydatiform.
That's what I said.
I didn't hear you. You said hypothyroid is. I heard you. I'm like, no, I heard this time. Okay, don't play with me. All right, hydatiform mole or gonadotropin is a something. Okay, there's another name for it as well. Okay, hydatiform mole because of the elevated HCG. Remember, pregnancy test measures the HCG hormone, elevated HCG hormones. However, with this tumor, there is also elevated HCG hormone. So that's why you can't say that a positive pregnancy test is definitely an indicator that the client is indeed pregnant. Does that make sense? Okay. Other probable signs, which again is just probable, is not a true indication that this client is indeed pregnant, is the Braxton Hicks, which are basically false labor pains. And with the Braxton Hicks, make sure you know, because you're going to see it more frequently throughout this term, where the uterus is basically tightens and it relaxes for a short period of time. But these contractions,
the end.
huh?
I thought that happened more at the end when your body's preparing you to have the baby.
That right, but you can also, that's why it's a probable sign. When we're trying to say that indicate whether or not you do have pregnancy, so you want to say no. Okay. Now again, the book has it under Braxton Hicks with those false contractions, but they're not strong. The difference is that they're not strong in the beginning. Okay, and also in addition to these pains happening later on, is that in the early phase, right? Again, they do not follow a particular pattern, okay? That's the other thing that you need to know, okay? But again, these are all probable signs. Now, the other probable signs, again, like you said, pregnancy tests, because they measure the HCG levels, but then you have also the positive signs of pregnancy. What is a positive indicator that, yeah, buddy, ain't no doubt about that? You got something baking in the oven. Well, you have a human being baking. Let's be specific because it could be the tumor, okay? But you definitely pregnant. What is it? Ultrasound. So these are objective data, okay? What else besides the ultrasound? Huh? You better have fetal heart tones, okay? What else? The book mentions.
Blood test, right?
Huh?
The blood test confirms that.
The blood test is on that list?
No.
Because I was making sure because I remember the blood test.
Fetal movement.
Huh? Fetal movement, fetal heart tones is on that, I remember. And what else?
Auscultation.
By whom? The provider also feels movement. Again, the provider, generally is the physician, okay, also feels movement. And they determine, yeah, you're pregnant, okay? So make sure you know the positive, the probable, and the presumptive signs of pregnancy, okay? Don't play with me, all right? Did I miss anything else on this slide? No, okay? Again, I put all these different signs here for you to help you, hopefully help you understand the different signs and symptoms of pregnancy, both subjective and objective data. Now, on page 304, you need to know the different changes that does take place as it relates to this, the mom adapting to pregnancy, the changes that happens physiologically. With the uterus, for example, you'll notice that the uterus grows during pregnancy because its muscle cells increases slightly in size and also in number, okay? And you'll also notice that there's uterine contractility and there will be some spontaneous and irregular painless contraction throughout the pregnancy. With the cervix, between weeks 6 through 8 of pregnancy, you'll have what's called the Godel sign. This is a thing that you need to be very familiar with up until you pass NCLEX on your first attempt, because you may be tested on this on NCLEX. Okay? You need to know this. After what you do with NCLEX when you pass, what you do with that information is up to you. But up until then, you know this, just in case it comes up. The Godel sign is where the cervix softens. Make sure you know that. You also should be familiar with the Chadwick sign. What is Chadwick? Bluish discoloration, okay, of the cervix. And why does that bluish discoloration take place? Anyone knows or read that far in the book? Do we know? Why does a bluish discoloration take place?
As the connective tissues of the cervix undergo biochemical modifications in preparation for labor that result in changes to its elasticity and strength.
Okay, let's just say because there's an increased blood flow. There's just an increased blood flow, okay? And also there's an increased level of hormones, hence why the bluish color. All right. Also, make sure you you're familiar also that with regards to the cervix, it also makes a thick mucus plug that seals the cervix and it serves the purpose of protecting the baby from infection. Very important. Now that mucus plug will be expelled at some point, usually later. It should be expelled as you get closer and closer to delivery or delivering the baby, but that mucus plug will be formed by the cervix just to seal the cervix and protect the baby. And about 4 weeks prior to birth, right, the cervix begins to soften, it thins, and it stretches in preparation for labor. Very important, all right? And all of this happens because of hormonal changes taking place. The vagina also goes through changes as well. During pregnancy, you have an elevated level of estrogen that raises the blood flow to the vagina, and it causes that vagina to thicken, stretch, and that also helps with preparation for the birth as well, okay? Now, with the vagina, you need to know as registered nurses that it is common for people to notice this whitish, yellowish discharge, aka leukorrhea. Okay? It is perfectly fine. Usually happens, or they may start seeing it usually around the second trimester. Now, it becomes a problem when it is like malodorous and it's more than just yellow. It's very purulent. The discharge is, I want to say more than funky looking. Like it's like thicker, odorous, like mild odorous, I should say, then that's a problem, okay? Now, because of the changes that does happen around in the vagina, there is going to be the increased risk of yeast infection, so which can be uncomfortable, but if there is yeast infection, just make sure you educate the client that it's not a danger, okay? It's just going to be uncomfortable. We just teach them how to wipe properly, how to take care of themselves properly, just to keep it from getting worse, all right? Now, with that yeast infection, just know that they can pass to the baby. They can pass that yeast infection to the baby during birth, which can cause something that's called thrush, which you should be familiar with that term. And that thrush appears as white patches in the baby's mouth, but it's easily treated with an antifungal. Okay, it's not a huge cause for concern if that does take place. All right. That's for the vagina. Ovaries, during early pregnancies, the ovaries get bigger and they enlarge because, again, of due to increased blood flow. But you can't feel the ovaries till about maybe no sooner than 12 weeks of gestation, okay? That's when the uterus is starting to grow and fill the pelvic or the pelvis, all right? Now, ovulation should stop, okay, during pregnancy, because now these hormones are preventing the release of the particular hormones specific for releasing ovulation. helping with ovulation. The ovaries help make hormones early in pregnancy, but by week 6 to 7, that placenta is going to take over and start producing the hormone progesterone. All right, that's the main changes with the ovaries that you should focus on, and then the breast. Yeah, baby, during pregnancy, the breasts will get larger, they get fuller, and they get more sensitive. Okay, or tender. Now, all of this again is because of increased hormonal changes. Blood flow increases, making the veins more visible. You'll see even some pregnant women, they'll even have stretch marks too. The nipples and the areola, you should know this, they start to darken and enlarge, and the small glands on the areola help keep the nipples moist, which helps with breastfeeding. Now, again, stretch marks may appear. They can be either pink or purplish in color, but later, or sometimes they may fade to even a silver color, depending. But they may or may not disappear, depending again how mom takes care of herself. But by the 3rd trimester, there is a thick yellow fluid. That thick yellow fluid you must definitely be very familiar with, and it is called colostrum. Okay, colostrum is that fluid that leaks up out of the breast. You must educate the mom that this is perfectly normal and it is not a cause for concern, so she don't get all worried unnecessarily. This colostrum is the baby's first food, actually, before breast milk comes in. Okay, so typically. All right, any questions on that? Pretty good. Keep it moving. Now we have the reproductive vessels. Okay. Going more into the uterus more, just know that with regards to the uterus in pregnancy, there is decreased uterine vascular and muscle tones, okay, that does help to tend to elevate blood flow. I do want you to know, for test purposes, especially for the upcoming assessment, or either the next one or the one afterwards, but you do need to know the size, okay? The weight of the uterus does increase from about 70 grams to as much as 1,100 grams at term, and it has a capacity to increase from about 10 to as much as 5,000 milliliters that it can hold, right, in terms of weight. In late pregnancy, lying flat, this is also very important. Lying flat on the back, what can that cause if the mom lies flat on the back? What can that potentially lead to? What did you say, Zelda? Dizziness. I heard something.
Say it out loud. You heard it right.
Compression of the vena cava.
Oh! Look at Lorianne trying to make sure she passes the next exam. Okay, don't play with me. All right. What else? Gladys, you were saying something.
I was saying something about the oxygen.
What about the oxygen?
Basically what she said, the heart.
The levels drop.
Okay. Like,
Wait, what
she
page
ain't
is
talking about the
that
oxygen.
What page is that
Don't know. I didn't even write it down. My bad. It's after 304.
Oh, maybe that's so.
Maybe 307.
Between 304 to 307. Okay, because I know I try to put these in order as much as possible. Okay. Just know that lying flat, like you said, can cause lying flat on the back can cause the heavy uterus to press on a major blood vessel, which lowers blood flow to the heart. And you can, as a result of that decreased blood flow to the heart, it lowers the client's blood pressure. All right. When a person sits or stands, this can lead to dizziness that you were talking about. This can also cause nausea, weakness, or even sometimes fainting. So what you can do to help alleviate that is have the client turn to their side to relieve the pressure and improve the blood flow. Very important, okay? Usually that's one of the main nursing interventions you'll find yourself doing when you're caring for the pregnant woman, especially during the late trimester, all right? What I want you to also take note of is the fundal height. Do not play with me on the fundal height. Make sure you know that the fundal height is correlated with the gestational week. Tim, can you explain to me what does that mean when I say that the fundal height correlates with the gestational week? Give me an example to elaborate more what you're talking about. So if there's a fundal height of 22, what does that mean? 22 inches, I believe. Okay? No, that means, okay. Yes, it's very important. That's why I'm stressing this. If the fundal height is 22 inches, you're expecting that the gestational age is 22 weeks. Does that make sense? It should correspond. It's a problem if, let's say, you have a fundal height of maybe, I don't know, 30 inches, and the client is only 15 weeks.
Well, she got twins.
I mean, true, that's a possibility.
That's the only reason why it would be off.
That's not the only reason. That's one of the reasons. Okay. How does that warrants further investigation. Maybe she got too much amniotic fluid. Damn. Okay, so that warrants further investigation, in other words, right? So, again, the fundal height should correspond with the gestational age of the client. But you are right. Fat is a reason, okay? Another reason, maybe, possible reason could be uterine fibroids, too.
Oh, yeah.
Yeah. So it could be dangerous. So we don't want to play with that, in other words. Okay? Uterine fibroids, and it's in your book, too. I mean, yes.
I need to find out what page that's on.
Yeah, it's on page 305, the take note in the box.
Thank you very much, because I forgot to, let me write that on my thing. 305?
Yeah, it's a take note box on 305.
Okay, now, notice what we said, because listen to me well, because you know my scenarios. I love stories. And you know you got to pay attention to the data very carefully. Don't play with me. By 36 weeks, the top of the uterus reaches its highest point. That means it's going to be as high up to the xiphoid process, right? But as the baby moves down the pelvis, okay, by 38 to 48 weeks, the uterus is going to be lower. So do you expect by 38 weeks that the fundal height should be 38?
No.
Lower. Thank you. Pay attention to the timing. Don't play with me. Okay? Steph?
Wait, should we close the door?
Nah, wake him up. Let him wake up. Okay? You can close the door. I'm just not being concerned about everybody else. Okay? So, and now when the baby does lower down the uterus, it does make breathing easier for the mom. The uterus, that is called lightning. Okay, just like lightning strikes the baby. Okay, I don't know if that makes sense, but lightning, okay?
You don't
So
feel any lighter.
you don't feel it, okay? In the first time pregnancies, or in other words, for moms who's pregnant for the very first time, lightning usually happens about 2 weeks before labor. Usually happens, okay? But in later pregnancies, it's often happen when labor begins. So those who have multiple pregnancies, they usually experience the lightning closer towards labor, okay? And as the baby moves down, pressure on the bladder increases, of course, okay, causing frequent urination. So again, you can expect urinary incontinence to take place because that baby is pressing down on the bladder, all right? Especially seen during early pregnancy. Any questions on that? Okay, very good. Now, what's happening GI-wise? Because there are also some GI changes. This is on page 307. I marked that. Okay? All right? 306? It starts?
It starts on 306.
Oh, 307 ebook wise, okay? All right. Now, what do you expect to happen or expect to see GI wise in terms of GI changes? Yeah. Digestion is going to slow down. Okay, make sure you do know, of course, everything is slowing down. And again, this is happening because of hormonal changes, especially as the hormone relaxes the muscles of the GI tract. That's why you expect the GI digestion to slow down. One of the common subjective complaints is heartburn. Or another one is indigestion. Make sure you know the other name for heartburn or indigestion, because I might put one or the other. Do you know what it is? No? No one knows? Huh? Dyspepsia is one name. Yeah, I think your book has a very nice little name that's not common. I think it's a P word. Pyrosis. I mean, I might throw that in there. I might feel like, you know what I'm saying? I want to be medical. Why? You know what I mean? I'm just saying. You know, make sure you know your medical terminology. Good. Nobody testing now. Testing time is over. Tell me to be quiet. Okay? So make sure, just in case you know what I'm feeling like, you know what I mean? Know the synonyms. Indigestion, pyrosis, heartburn, same enchilada. Now, why does this happen? This takes place because the valve between the stomach and the esophagus is relaxing, allowing for that acid reflux to take place, or the acid to just back up. Okay, and that's why they experience heartburn and indigestion. Anybody have any suggestion on what to do when a pregnant client does complain of pyrosis or Zelda and then Black?
Probably smaller, more frequent.
Smaller, more frequent meals, yep.
Sit up for at least 30 minutes after they eat.
Yeah, don't be like me and, when the itis kick in, just go straight to bed. No. But yes, those are good suggestions. Definitely smaller, frequent meals. Try to eliminate certain types of food like spicy meals and carbonated drinks and stuff like that. That also helps. Yes, Janessa?
So, essentially, what you would tell a patient with GERD?
Yes. Okay. Look at you. I like it. Okay. All right. So the other GI issues that you may see, gums may swell and bleed easily. The taste bud does change. What they used to like may not like anymore, or it's not, or maybe all of a sudden they might like things that they've never liked before, or start craving things that make no sense too. Because I know I was hungry during the days. Anybody ever had cheeseless pizza?
Had one.
Yeah, it does. Yeah,
yeah.
Right with tomato sauce.
And then it came and it was like, what was I thinking? So yeah, I'm just saying, that happens. So your taste bud changes a little bit. Some people also experience what's called excessive saliva. Again, I may or may not decide to put on the test excessive saliva. Because I might decide I want to sound smart and intelligente, and say a word that I cannot pronounce. The botulism.
What?
P-T-Y-A-L-I-S-M. Okay, that one.
No, there's another one.
Yeah, what's the other one? Please pronounce it. Silaria. That's how you pronounce it?
I think so.
As long as you can see it and identify it.
What?
307.
306.
306? Oh, 306. Okay, sorry. All right. That's the other term for excessive saliva. You see, you've been warned. Don't play with me. Okay? Now, they experience this excessive saliva, especially early in the trimester, especially the first trimester. It is not fun, okay? Hold on. Anyway, I got stories galore, but we're gonna keep it moving. Slower digestion can cause bloating and constipation, of course, because they tend to absorb more water and more food. That's why they get bloated and constipated. Constipation can also worsen because of certain medication. Michaela, what medication can cause constipation that the client who is pregnant might need? Michaela. Her name is Michaela too?
I was gonna say that, don't worry.
Yeah. Okay. Madison. Follow-up question. Your client's iron level is low. She's pregnant, first trimester. Ordered iron. And she's complaining of constipation. See, this is an easy question. What would your nursing care plan or intervention include?
So she's taking iron and she's complaining of constipation. Drink more water.
One. What else? That's easy. What else?
I don't know. Increased fiber.
That's two. What else? Let me write this down.
Vitamin C?
Take a stool softener.
Hold on. Wait a minute. Hold on. Take iron. Increase H2O, fiber. What else did you say?
She can use a stool softener.
She may need stool softener.
She takes it with orange juice to absorb better.
More vitamin C.
Vitamin C. So I like that. Take it with orange juice.
Increasing activity level.
I guess some exercise.
Hold on. Vitamin C. Increase vitamin C intake. Yari?
Would the vitamin C help with the constipation though, or is that just to increase the absorption of iron?
The absorption.
Yeah.
So like if this was a select all and what it did for constipation.
Constipation, this won't be in there. Look at you, Yari! Yari not playing, boy! Look at her! Yari! Girl! I feel like yelling to the world right now. Listen, TikTok, Yari ain't playing with me this semester, okay? Alright? Look at you. You jumped the gun, okay?
Wait, can you just have me say that?
Constipation. Yari, because my question was focused on constipation.
Well, why wouldn't vitamin C be on?
No, because vitamin C does not help with constipation. It helps with absorbing the iron. Yari's making sure we answering what was asked. She jumped the gun. Okay. Respect. Okay. What else?
You didn't write increased activity level.
Oh, increased activity level. Okay, all of this is for constipation, except for this. All right? Read carefully. All right. Now, outside of constipation, because your client is taking iron supplements, is there any other, anything else that you would incorporate into the care plan? We said vitamin C for absorption. Anything else?
Avoid taking it with milk.
Period. Okay. Avoid milk. What else? Any education you would provide?
If it's in liquid form, drink it with a straw.
Okay. Drink liquid form with straw. Okay.
Oh,
yeah. That's what I'm looking for.
And your dookie change color.
Educate on the color of the stool. Because you do not want for your client to come into the emergency room talking about I'm bleeding black down there and come to find out they were only taking iron tablets. Okay? Education is very important. Okay. Yari, you made my day. You see I was starting off to have a bad day. Thank you. You made my day. All right? Constipation. All right. Also, because of GI changes, there are increased risks for hemorrhoids, right? What can we do for hemorrhoids to help alleviate hemorrhoids? The sits back, what were you saying?
Which hazel, she said
I
which
said
hazel.
witch hazel, also putting your legs up. When
Yeah,
you're-
bring your
Bring your
knees
feet
up.
down.
Yes, and try not to sit on the toilet commode for too long. Just go when you feel like you gotta go, those things. Okay, very good. Another issue, yes.
Shouldn't they not push too hard because of the vagal nerve? Because it'll drop the heart
That's
rate.
like anybody too.
Yeah. that's-
True, but it's worse for them because was it Gladys that said that their blood pressure already goes down? Yes, that's why you go when you feel like you need to go. Don't sit, don't force it. Hence why you want to do this too. Okay, Yari, you see you got competition now. Okay, y'all trying to make my day. Now let me stop, okay? Let me stop instigating here. Very good. Morning sickness is another GI change that can also take place, like nausea and vomiting, and usually it starts around 6 to 20 weeks. Just know that with regards to nausea and vomiting, there are clients that, and we'll talk about this more later on, they do suffer from what's called hyperemesis gravidarum.
Yep.
I can't pronounce that right. No, well, don't come for me. All right, this is when they spend the majority of their pregnancy just vomiting. Okay, and that becomes an issue. Also note that pregnancy does increase the risk of gallstones, also known as, what you should know from med-surg, cholelithiasis. Again, because the gallbladder empties very slowly. So if that is the case, just know that treatment does include surgery, like laparoscopic cholecystectomy maybe, only if it's safe during pregnancy. They're gonna have to weigh the risk versus the benefits. They do have to do that route. But usually this is why we encourage the client to increase their fiber intake, increase their water intake, try to avoid certain foods, especially if they're at high risk for gallstones. You want to make sure you encourage certain foods or avoid certain foods as well. And make sure you do know, according to the book too, there is an increase for elevated cholesterol as well. So again, watch your diet. Don't go eating all these chitlins and Mickey D's and stuff like that. So GI changes are definitely uncomfortable, but they are usually for the most part temporary. Okay. All right, let's go next. Then we have the hemodynamic engine, or in other words, the cardiac system on page 3, maybe 307, 308. I have 308. I went from the ebook.
307.
307. Okay. So now this is very important that you do need to know. During pregnancy, the heart and blood vessels does change and require more oxygen and blood supply to the baby and to the uterus. So as a result, you'll see that the blood volume will increase as much as 50% from extra plasma. And the purpose of this extra blood volume is to nourish the baby, all right? It also helps support the growing uterus and prepare the blood, prepare just in case there's blood loss during birth. That's why the mom needs that extra blood volume, okay? Because of the plasma increasing, there's going to be more red blood cells, and those blood cells become, the blood in turn does become more diluted, and that can cause normal physiologic anemia. This is why the client is prone to anemia. So one of your definitely labs, but one of the data or labs that you're going to be definitely closely monitoring the client for is their RBCs count, okay? Monitoring for anemia, because pregnant women are at high risk for anemia due to these changes. Just know that the heart rate will increase, and the heart will pump more, about, give or take, about 40% more blood. Heart rate will increase at least 10 to 30 beats more per minute. Lying on the back again can reduce blood flow. Make sure you remember that, which again can lead to dizziness. And again, we want to improve that by having a client lie on their side. The heart is enlarged slightly, but just to handle that workload slightly. Now, when we get to the cardiac demise later on, we'll talk about the different cardiac distress that a pregnant client can endure. But for now, you will see an enlarged heart, which is normal, but it's going to just enlarge, just large enough just to handle the different physiological changes. Blood pressure does drop during mid-pregnancy, just again as the blood vessels relaxes, and it usually returns to about normal near the end of pregnancy. Just note that a sudden rise in blood pressure is not normal. Let me say this again. Yes, you do expect that the blood pressure can rise gradually, but a sudden rise, all of a sudden, there's a rise in blood pressure, that warrants further investigation. That's a problem. We're going to talk about that too. The blood components includes red blood cells increasing, but not as much as the plasma. The need for more iron does increase, and many pregnant people do take the supplements, iron tablets, just like we discussed earlier. And of course, the blood becomes the blood becomes more likely to clot. So this is why we are definitely encouraging our mothers to do what if they are likely to clot? Well, if the blood is more likely to clot, what are you encouraging? Movement. You better get up and move. Okay, if it's not a contraindication, of course. All right, but if it is a contraindication, and because there is a high risk of, let me step back. If movement, getting up and walking, is a contraindication, because there are some pregnancies where it would require the mom to even stay on bed, complete bed rest for the entire pregnancy, depending on the severity of how bad things are going with that pregnancy, then you still have to have some form of movement. Either you have compression stockings, or maybe you tell the mom to move their feet in bed if they can, just a little bit, but you want to try as much as possible to prevent that blood from clotting, okay? So these are the normal adaptations that takes place all to support the growing baby, all right? Now, oxygen, respiratory system, okay? Now, pregnancy does cause normal breathing changes, but it does have to meet higher demands for oxygen. And you get the higher demands to meet the needs of both mom and baby. Oxygen need does increase by about 20 to 30% during pregnancy. You will notice that the growing uterus pushes the diaphragm upward, okay, like we said earlier, and it leaves less space for the lungs to work and do what it needs to do. This is why you'll see pregnant women have a lot of difficulty breathing, especially as they near towards the end of pregnancy, okay? So what happens to compensate is that the chest is going to widen so that the breathing eventually then becomes deeper. Not faster, but deeper. Very important, okay? Now, you also need to know that the amount of air taken in with each breath does increase up to about 40%, which can lead to shortness of breath, again. Now, you'll notice this taking place especially during the late phase of pregnancy, because especially as that diaphragm is pushing up against, not the diaphragm, the uterus is pushing up against the diaphragm or the xiphoid process. That's what makes breathing a little bit more challenging for this client, all right? So most breathing does shift to the chest and the diaphragm instead of to the abdomen, and most pregnant women do feel short of breath, especially, like I said earlier, late during pregnancy. The problem becomes especially those who have respiratory issues such as asthma, okay, or lung disease. Now their workload or their respiratory workload becomes more and more challenging, making breathing more difficult, okay? Now, because of that, if you have a client, especially during pre-pregnancy, they have a history of respiratory issues such as lung diseases or something like asthma or bronchitis, they will definitely require more frequent monitoring than others because of that respiratory or the risk for respiratory demise, okay? All right. Also, you need to know that hormones also increase blood flow to the nose and airways, which does lead to congestion, stuffiness, and sometimes for a lot of clients, not a lot, but some clients, they'll get nosebleeds as well. But again, these changes are temporary and they should be relieved once delivery does take place, okay? All right, that was oxygen, where am I? Renal, okay? Now, with the renal or the urinary system, Now the kidneys and definitely the urinary system is going to be working harder. It does that to handle all that extra blood that's flowing to and fro throughout the body. And it's also trying to handle all that extra waste that is traveling from both the parent, or the mom, I should say, to the baby. Okay? Blood flow to the kidney does increase, allowing them to filter more waste and make more urine. This is why the mom, one of the constant complaints is they gotta go. Okay? Urinary frequency. Okay? Or increased urinary frequency. The kidneys does enlarge, and the kidneys enlarge, and the kidney and pelvis and the ureters, they do widen and stretch. And because of that, there's slow urine flow. Now, if there's slow flow or slow traffic, urinary traffic, so to speak, okay, or slow flow of urine, what can that potentially lead to? UTI. Okay. Nurse Sarina, ¿tú tienes un paciente? That's all I got. Okay. Pregnant. Let's give her 35 weeks. Okay, she's getting up there. And you already know, knowing the urinary changes that does take place, just like we described. You just said that she's at risk for UTI. Again, first of all, what would you incorporate into your nursing care plan? And what data would tell you indeed that she does have a UTI? Bam.
Increased white blood cells would indicate an infection.
So your assessment?
I would ask her if she has any burning sensations, smelly urine. If it's cloudy, has any bits in it, aka sediment.
All right. How would you validate that data?
I would ask for a urine sample. Hopefully the doctor ordered it.
If they didn't, what you gonna do?
Request it.
Okay, urine sample. And now, positive, she says she does experience burning. Urine sample says that is positive for E. coli. Now, what is your, what would be an appropriate nursing diagnosis? Oh, yes!
Something with hygiene.
Yeah.
Teach her how to.
I gotta see the nursing diagnosis book. Does it say something about hygiene in the nursing diagnosis book? What would be a appropriate nursing diagnosis? Dr. Sammy, I wasn't expecting that one.
Risk for infection due to related to
Not cleaning your coochie right.
yeah.
Only
That's a
children.
technical term too.
Okay, you said your risk for infection related to improper perineal hygiene.
Yes, as evidenced by lab results or patients.
Lorianne, AEB, as evidenced by what?
Physical assessment and lab results.
Okay, burning.
Yeah, there you go.
Patient complaint of burning. Let's put that. Lorianne, do you agree or disagree with this nursing diagnosis that your colleague has come up with for this client? And tell me why, real quick, because we're getting hangry. And we got one more chapter after this. Because your grade depends on this.
Evidence that it wouldn't be a risk for.
It would be. So you're saying you disagree? You saying you disagree with this nursing diagnosis?
Well,
don't worry, I don't think she know where you park at. She don't know your car.
Okay, wait. Did they complete the testing?
And I said urine sample. What did I say the urine sample?
It was positive for E. coli.
So it wouldn't be a risk, it would be the infection is there.
So you would have said infection related to improper. Okay. You see? Be careful. You still gotta do nursing process. If it take place or if it's there actually is no longer a risk. Okay? I just thought I'd throw that in there. What would be your plan and implementation now? Give me a plan.
A plan, medication, depending on, before the medication? Well, obviously I'm gonna educate her.
Okay, educate what?
On proper.
Okay, now you would put, medication is not bad. You would just prioritize your care accordingly. Okay? So, because we always want to try what? Least invasive before we go more invasive. Educate on proper perineal care. You could do, what else could you do?
Fluids.
Increase fluid intake. Maybe encourage some pure cranberry juice if you want to go that route, okay? And then,
Front to back.
say it again?
Front to back.
Thank you. Which is part of education. Very important. Do we see that? Okay. Now, also with GU, okay, yes, the kidneys does get larger. The kidneys are filtering blood faster and leading to more frequent urination. Again, lying on the side does help alleviate kidney blood flow. You need to know that. Now, it does also, because she's lying on the side, the client is lying on the side, it will increase urinary output, especially at night. You just need to educate that. It's more important for her to lie on her side to help with the cardiovascular changes as well, and the oxygenation too, but she's going to end up urinating. Yes?
For a patient that's pregnant that has high blood pressure due to kidney function, how does that affect their blood pressure?
Ooh, it will. A patient that is pregnant, and you said they have high blood pressure due to kidney failure, they are, number one, they definitely are going to be closely monitored. Because again, people in renal disease does have the tendency to, generally speaking, will have the tendency to have elevated blood pressure. Add that to a pregnant woman, now she's going to be at risk for, thank you. Okay, or even eclampsia, depending on the severity of that renal. They might even discourage pregnancy, depending on how bad is the kidney damage. Okay, she's gonna be now, depending on the age and culture and the personal desires and stuff like that, she may want to continue, with pregnancy, because that does that does happen. She's just gonna have to be very closely monitored. Okay, so instead of I think the frequency of going into visiting the doctor, like in the first trimester, is like maybe like a month or so. She might be seen every week throughout the entire pregnancy, depending on the severity. Okay. Again, it depends on how bad she is, but yeah, she's going to be closely monitored. Okay. All right. What was I going to say? Now, you do need to know, because the kidney does clear the drugs faster, some medications may need higher or more frequent dosing during pregnancy. Again, the decision to have the client take this medication during pregnancy, they're going to measure the risk versus the benefit, because there are certain medications that pose as a teratogen which is toxic to the fetus, in other words. Okay? And then also know that most kidney changes do peak around the second trimester and slowly return to normal after birth, though the bladder control may last longer. Okay? All right, moving real quick. Musculoskeletal, what happens is that the joints change, the muscles and the bones and the joints, they change all to support a growing baby and prepare for birth. Weight gain and the growing uterus shift the body's center of gravity, changing the posture and the way the person walks. So you might notice they walk like this, okay? Especially as they get closer and closer to delivery, okay? What causes this is the pregnancy, there's this hormone that the pregnancy hormone relaxes and loosens the pelvic joints, making the pelvis wider, okay? All of that is to help actually facilitate, delivery, okay? These joint changes, especially during the third trimester, the lower back starts to curve. So you'll notice, and I have it on this slide, what you'll notice what the client will look like, lordosis, okay? It happens especially later as you get closer and closer to delivery, all right? So you got the loose joints, the added weight, causing the client to walk or waddle, okay? And of course it becomes very uncomfortable. There's back pain, pelvic pain, leg cramps. Sometimes you'll see the foot swell, or there's gonna be pain in the wrists and hands as well, okay? Now again, these changes are normal. They just are very, very uncomfortable, okay? Especially during pregnancy. All right, you also make sure you do take note of the changes that does happen with the skin. Make sure you do know that the skin, hair, and nails go through many changes, such as with the skin you have hyperpigmentation, especially common around the nipples and the areola and other areas, and sometimes you'll have what's called melasma, or the mask of pregnancy is sometimes is what it's known as, okay? You definitely, if you're not familiar with it, you definitely need to know that there is this thing called the linea nigra. Nigra? Yeah, negra. Okay, sorry. All right. Definitely appears in the abdomen. Sometimes it goes away. Sometimes, some people it does not go away. Okay. Stretch mark, or the other name is striae gravidorum. Okay, appears in the abdomen. It can appear in the breast, the thighs, and many other areas. Okay. They may fade over time. And different people, depending on their cultural practices, have different ways of trying to keep that from getting worse, right? Some women may also suffer what's called varicose veins as well, or spider veins, is another name. They may also have palmar arrhythmia or pink palms, okay? All of that is because of the increased blood flow. Now, the hair and nails, I don't know. I thought it was gender-based, but it's not gender-based, okay? Some people, their hair grows. Some people, their hair gets shorter, okay? It is not gender-based, despite popular belief. It is all hormonal changes, okay? I thought if I had, my boy, I was going to have long, flowy hair. Here I am, okay? So, no, all right? Those can grow faster, but they can, for some people, become brittle, discolored, or even they may have what's called grooves as well. But again, it should return to normal after everything is said and done, the baby is delivered, okay? So, tips for vascular issues, what we want to encourage to help alleviate these discomfort: elevate your legs, avoid long period of standing or sitting, rest on your left side if possible. If there's no contraindication, walk daily, wear support hose, and definitely avoid tight clothing. This is not the time to be looking like Beyonce, okay? We gotta wear loose clothing so we can be as comfortable as possible, all right? All right, moving forward, okay, the hormonal symphony, definitely, in other words, the endocrine system, okay? So again, hormones help to control things such as glucose, fats, and nutrients, all of these which are sent to the fetus. Estrogen and progesterone are the main key players, especially when it comes to fetal development. So you have the thyroid, which becomes slightly larger and more active, and it does increase metabolism, and it is very important in terms of thyroid hormones for fetal brain development. And it is very important, especially early in the pregnancy, all right? Now, low thyroid levels or low iodine levels can affect the baby's brain development. This is why one of the labs that they do collect is the thyroid levels, just to see, okay, how that would affect, or the potential effects it can have on the baby. With regards to the pituitary gland, it also enlarges. Just know that the FSH and the lutein hormone, or LH, they stop producing, so therefore you no longer should be ovulating because there's a cessation in those hormonal production, specifically FSH and LH. Prolactin does increase. Make sure you know this. To prepare for breast milk production, but milk starts only after birth. Okay? Do not confuse the milk production that happens after birth with the other one, which is colostrum, which can happen before birth, but later in the trimester. With the pituitary, you have the prolactin, and then you also have oxytocin, also a very important hormone that you should be familiar with up until you take it past NCLEX on your first attempt. It causes labor contraction, and it helps control bleeding after birth. Right? It also triggers milk letdown during breastfeeding. All right? Make sure you know these hormones and the role that they play during pregnancy. All right? You also have the ADH, which basically stays the same. You know, it ain't doing nothing. It's just there as a spectator, in my opinion. Okay? Pancreas or the insulin, early in pregnancy, you have where the fetus uses a lot of glucose, so the parent's blood glucose sugar level may decline. But late pregnancy, you have where the placental hormone causes insulin resistance. So the body makes more insulin. This is why we do that very good tasting test. What is it called? Say it louder. What stands for? Okay, yes. Okay, you guessed well. All right. You guessed well. Very good. Okay, because we want to make sure you have enough glucose or how your body is adapting, right? If the pancreas cannot keep up, gestational diabetes does occur. Let me ask you, Yari, if the mother does develop what's called gestational diabetes, does that mean she will be diabetic for the rest of her life? Does that mean she won't be diabetic for the rest of her life? No. Okay? You can be diabetic postpartum, or you may not be diabetic. Okay? But it is a risk factor in terms of gestational diabetes. Okay? Gestational diabetes is a risk factor that we have to look out for, which is very important because if your glucose levels are off the wall, it's going to cause more problems for mom and baby. Adrenal glands that you have to know, just know that cortisol does increase. And the point of cortisol is it basically helps to manage stress, okay? And it also does help with metabolism as well. Aldosterone increases, helping the body to hold more fluid and expand the blood volume. And then also you have prostaglandins, which acts as a chemical mediator. Just basically help to soften the cervix and start to strengthen the navel contraction. That's what prostaglandins does. And then with the placenta, just know that the placenta acts as a hormone-producing organ. It's just pumping hormones, left, right, and center. It makes hormones such as the HCG. It helps with the production of estrogen, progesterone, and relaxin, which basically maintains pregnancy and prepare for the body for birth. And it also prepares the body for breastfeeding as well. So just know that pregnancy hormones does redirect energy to the baby, and it does prepare the body for labor. It does also help ensure with breastfeeding as well. Okay? Boom. Then we have the metabolic. Just know that on page 313, on box 1112. Am I still on? Okay. The baby does use a lot of glucose, especially early on in the pregnancy. The parent's blood sugar again decreases, and glucose easily crosses the placenta to feed the baby, but insulin does not. The baby makes its own insulin. Make sure you know that. That happens all early in the pregnancy, okay? Then later in the pregnancy, you have where the placenta and the stress hormones block the effect of insulin, causing insulin resistance, right? Because of this, the parent's body makes more insulin, so enough glucose stays in the body, or the blood rather, to help provide nutrient to the baby, or reach the baby, so to speak, okay? So that's that. With regards to the immune system, very important. The immune system, as we already know, it does protect the body from infection. But you need to know during pregnancy that the body will adjust accordingly, all for the purpose of protecting the baby and mom too as well, okay? Now, we already talked about the different hormones such as HCG, which keeps the pregnancy hormone working. And you have HPL, which helps prepare for breastfeeding or prepare the breast for breastfeeding. And we actually have relaxin. We talked about progesterone, which serves to maintain the uterus and the estrogen. With regards to the immune changes of the body that take place during pregnancy, the body does boost general or innate immunity, but does have a reduced targeted immunity or adaptive immunity. Now, with regards to the changes, of course, the changes again is to help protect the baby and prevent the body from rejecting the fetus. It also increases the risk of some infection, like we mentioned one earlier, UTI. There are some chronic conditions that may change, but you do need to know. I see your hands over. Hold on. Those changes, some of them can worsen. Those changes also can some of them can improve, and some of them can also stay the same. Yes, Zelda.
In the previous chapters, there were different hormones for the placenta, so we went off.
Really? I ain't catch that. What was the different hormones for the placenta? Ooh. You see? For the placenta?
It was HCG, HCS, progesterone, estrogen, and glucocorticoids.
Estrogen. Also, what they didn't add here was the glucocorticoids. Yeah. Glucocorticoids. And what you said? I have the ACS here. HCG, HCS, glucocorticoids, progesterone.
And glucocorticoids.
Okay. Just add to that list the relaxin. Okay. That's the only slight change. Okay. That's why I didn't pay attention to it, I guess. It's not so much significant. What else? Just make sure you review that table on 11.2, okay? All right, nutritional requirements. We've already been talking about those nutritional requirements. Don't play with me. We already should know that nutrition is very important. What should be consumed? What's the main nutrient that we are concerned is consumed prior to pregnancy? Folic acid, okay? Now, is that the only nutrient we are concerned about? No. Yeah? What other nutrient? Yeah, what's the other nutrient?
Vitamins. All the vitamins.
All the vitamins. Okay, don't play with me. All right, just make sure you know if they have too little or too much nutrient, it can increase the risk of preterm birth, birth defects, miscarriage, gestational diabetes, high blood pressure, poor fetal growth, and of course neurodevelopmental problems. Okay, this is why we need, like what Gladian was, I hope she was trying to say, prenatal vitamins. Okay, to provide those nutrients. So in addition to folic acid, we need iron, maybe. Okay, which usually is not met enough through food alone. So sometimes you need iron supplements. Okay, just make sure with regards to the intake. I will be testing you on the amount of folic acid. 400 micrograms to about 800 micrograms, okay? Higher dosage of folic acid is used if there's a history of neural tube defects. So usually the start-off point is 400 micrograms. They'll usually encourage at least 400 micrograms. But if there is an issue or the physician suspect based on the client's history, medical history, they might encourage up to 800 micrograms, okay? So eat well. All right, we should know with regards to food safety, again, limit your caffeine, avoid alcohol, eat foods rich in protein. We definitely do not want to, or we try to encourage the high consumption of mercury in the fish, so try to avoid, or if you gotta have the fish, low amounts of fish. All right, but it definitely better be cooked well. None of this sushi. thing, okay? Also, just make sure you know that artificial sweeteners are considered safe, but should be used sparingly according to the book. Fish is healthy. The book, just know that for the most part, we do not, it is discouraged to a high consumption of fish, okay? Because of that mercury. And then, of course, because Listeria infection is a high risk, what foods are you telling them to avoid to not get Listeria infection? Deli meats. Okay, very good. All right, boom. All right. So, boom, for this chapter, we want to make sure you have the growth. Do not play with me on the BMI. You have already been tested. Yes.
Do we need to know table 11.4?
What does it look like?
Dietary recommendations for a cardiovascular person.
Let me see what it says because I got my book. Because I think I do have something on there.
You said just the folate or all of it?
Oh, I'll be test you on folate. I'll be nice to you. Iron, folate, but you should know to have adequate amount of nutrients. But in terms of consumption, the amount, folate. 4 to 800. Yeah, 4 to 800. That's the one I was focused on. Okay? I shouldn't have said that. I should make y'all read the whole table. But anyway, see, I like you today. Only because Yari made my day. Thank you, Yari. And Serena. Recommended total weight gain? Do not play with me. It's somewhere in that chapter towards the end. Okay? Underweight. If the client is deemed underweight, an underweight Alec is what BMI? Under what number? Hurry up. 8.5. Okay, thank you. Okay, very good, Alec. The recommended total weight gain is 28 to 40 pounds. Okay? Normal weight, which is 18.5 to 24.9, we're encouraging a weight gain between 25 and 35 pounds. And then overweight, which is a BMI of 25 to 29.9, we are encouraging a total weight gain between 15 to 25 pounds. Now, if you're obese, it's less, okay? No more than 20 pounds, between 11 and 20 pounds. Just make sure you know if there's little weight gain, just make sure you pay attention to the risk factors, such as preterm birth or low birth weight, for example. So to help alleviate that, we want to encourage high-calorie, nutrient-rich snacks, for example. But if the weight is too much, there's an increased risk of certain issues such as gestational diabetes, high blood pressure, maybe a cesarean birth. So you want to, again, encourage the mom to watch their weight, okay? Eat accordingly. Eat enough for their weight, not to gain too much or too little, all right? So steady weight, healthy weight, pretty good. That's basically all you need to know for chapter 11. It's not that much. And you're like, nah, professor. All right, what time is it?
11:53.
11:53. Okay, I am going to upload my notes for chapter 12. Don't be guessing. Okay. What did I put my paper? Oh, you see why I don't do paper? I'll upload it for you guys. And this is basically what I will be testing you guys on. Okay? I thought I had already uploaded it.
Nothing on Pika.
Huh?
Nothing on Pika.
Pika?
Pika?
You should know Pika, yeah. It's on chapter 11?
Yeah.
Oh, under nutrients. I was going fast.
It says Garden cravings, soil, clay.
Yeah. I didn't mention it?
No.
Oh, my bad. I was trying to hurry up. But yes. I didn't mention it. Thank Rebecca. You will be tested on pica. Know what it is. Okay? The education you should be providing as it relates to pica. What is pica again? Yeah, eating non-food food, unedible stuff like dirt.
Yeah.
Is ice consumption considered pica?
Yes.
Oh! Okay. All right. Y'all ready for this test? All right. Let me upload this right now before I forget because I will. Oh, those 200. All right. Bye. Chapter 11 is done.